Okay, let's see now some additional details about the synovial joint. First of all, there are 6 different types of joints, or of specifically of synovial joints, based on the shapes of the articulating surfaces. Um, Remember, the articulating surface is the area where the two bones are meeting each other. So based on this shape, we have 6 different types of joints. So the pivot joint, these are like this. So there is an axis, and there is a sleeve surrounded by a sleeve, and the rotation will be around this axis, like the one, for example, between C1 and C2, the cervical vertebra, the first and the second one. So this would allow side to side rotation of the head. So this is like uniaxial rotation. So it is rotating around one axis. So this is number one. The second type is something called the hinge joint. So there is like the hinge, like the door hinge. And here also we will have like not a sleeve, like a hinge, and the other bone is like fitting on it. So here we have side to side movement, like the joint of the elbow. Okay, that's what how the joint of the elbow is moving in this direction. So this is also uniaxial movement. So it's moving around also one axis, which is this one. The third type is something called saddle joint. Here we have two articulation surfaces. There is a movement that is happening around this line or this axis, and also there is a movement happening around this axis. So this is biaxial movement. Okay, like the one, for example, between the carpal bone and the first metacarpal. That's the base of the thumb. Okay, so the thumb can move in two directions, and that is biaxial movement. This is what do we mean by biaxial for the thumb. This is one, okay, and this is the second one. The first one was like this, and this is the second one. So this is the biaxial movement of the thumb. Then there is the plane joints. Here we have flat surfaces between the bones, and technically the bones are gliding or sliding above each other or along each other. So here there is no axis or no axial movement. They are just gliding. Okay. The fifth type is something called condylar or condyloid joint, like the joint between the radius and the carpal of the wrist, as you can see this one. Okay, here also we have two axes that the joint is moving around. So this is also biaxial movement. And the last one is something called the ball and socket. So there is a ball, and above it there is a socket surrounding it. And here these are the hip and the shoulder joints. Okay, these are the only two examples of these are the only two examples of ball and socket joints. And these ones are moving in 3 axes or along 3 axes. They can do left to right, they can do front to back, and also they can rotate. So this is like a 3-axis movement or triaxial movement. Okay, so these are the 6 types of joints, of synovial joints, that we have in our body. What you need to know is the name of each type and an example. So I will write them: name, example, and the movement. Okay, so that's what you need to know for each type of joint. Now, before going into the movement allowed by these synovial joints, there are two concepts we have to understand: the origin and the insertion. Origin is the attachment to the immovable bone, whereas the insertion is the attachment to the movable bone. What does this mean? For example, you have the elbow. The elbow is... So for example, you have the elbow. The elbow is a result between articulation between the humerus, right, and the ulna and the radius. So we'll just draw one of them. Okay, here there is the muscle, okay, that is, when it's contracting, it's bringing the ulna toward the humerus. So as a result of this contraction, the muscle is bringing the ulna toward the humerus. So this muscle has two attachment sites, one on the humerus and the other one is on the ulna, right? So in this case, what was moving? The ulna. The ulna was moving, whereas the humerus did not move. Right? So we will call the attachment of this muscle on the humerus as the origin. So this is the attachment on the immovable bone. Whereas the attachment on the ulna, we will call it the insertion. Okay? The attachment on the movable bone. So this is the origin and insertion. And of course, these are like very flexible terms. I mean, and of course, these are flexible terms. Like for example, for the humerus, you know, there is the shoulder joint, and the shoulder joint is between the humerus and the scapula, okay? And of course, there are some muscles, okay, attaching to bone, or sorry, not, and of course there are some tendons, okay, attached from the muscles to these two bones. Now we understand when we are moving our shoulder, we are moving the humerus, right? So most likely the insertions are happening on the scapula. The origins are on the scapula, okay, whereas all the insertions are on the humerus. So in this case, the scapula is the immovable bone, whereas the humerus, this is the humerus, is the movable bone. So this is the concept of origin and insertion. So for these movements, we have in general three types of movements. We have the flexion, extension, we have abduction, abduction, and we have the circumduction. The flexion, extension along the sagittal plane, adduction, abduction along the coronal plane, the circumduction and rotation, they are not associated with any plane. For the flexion extension, usually flexion will decrease the angle of the joint, extension increases the angle of the joint. This is if the movement is happening toward the anterior, okay, toward the anterior. So see, for example, the body, the trunk, when we are bending down, this is a flexion. When we are getting back, this is extension. And sometimes we can go even beyond the anatomical position. This will be hyperextension. So flexion, extension, and hyperextension. The same thing for the arm. Flexion, when we return the arm to the extension, okay, and when we return it to this position, it will be hyperextension. For the leg, there is only the flexion when we return it backward, and then there is the extension. So there is no hyperextension for the knee or for the lower leg. So it's only extension and flexion. The head, the same, for the head, the same thing, flexion and extension. Then there is the adduction and abduction. Abduction is taking it away from the trunk. Adduction is adding it to the trunk, whether it's on the arm or even on the leg. So if I move the leg to here, that's abduction. If it's moved to here, that is adduction. Circumduction is the movement in a circular shape. Okay? The circumduction is happening here. So the entire arm is moving like this. Okay? The entire arm. Think if you are standing and you are trying to draw a circle with your palm. So you are moving your entire arm, and the movement is happening from the shoulder. That is the circumduction. Then there is the rotation. Rotation is uniaxial. So we are rotating around one axle, like movement of the head, movement of the leg. Okay, and it's happening for the leg. Either it could be happening at the knee, around the knee, or even a little bit on the hip. The same thing for the arm. If you fix your shoulder and you are trying to move your palms up and down or flip them, so that's a rotation happening in this area, which has a special name that we will see it later. Or actually, this is it. So here, the movement of the palm between these two positions are called the supination and pronation. So if you are in the anatomical position and you are flipping your hand, that is the pronation. If you are returning to the anatomical position, this is supination. And this is rotation. Technically, these are like kind of a rotation between the radius and the ulna. So here the movement is happening at the elbow, not at the shoulder. If it was happening at the shoulder, that could be just normal rotation. Okay, but here this is a special movement between the radius and the ulna, the supination and pronation. Another special movement is for the plantar, for the foot. So if you are bringing your foot toward up, that's dorsiflexion. If you are extending them toward the bottom, that's plantar flexion. Now, why do we need to know all of these terms? Because this is how you are going to describe the situation of your patients. So you'll have patients having problems in their back or in their spine. They can't do dorsiflexion. They can't do plantar flexion. Or you will have patients with injuries in their elbows or in their shoulders. They can't do rotations. They can't do adduction, abduction. So how you are going to describe this or describe their case by using these terms. That's why you need to learn these terms. Another term is the inversion and eversion. Inversion is moving technically the toe of the foot toward the midline of the body. Eversion is moving it away from the midline of the body. Usually this comes with a slight elevation of the foot. That's inversion and eversion. Then there is protraction and retraction. This is the movement of the mandible, the lower jaw, either toward the front, that's protraction, or backward, that is retraction. Then there is the depression and elevation. Depression is opening the mandible. Elevation is closing it down. Like when we eat or when we talk, technically we are doing depression and elevation. So now you can go and tell someone to shut up. Instead of saying like shut up, you can say elevate your mandible. They won't understand what you're saying, but anyway. Then there is the opposition and reposition. That is a special movement of the thumb. So the thumb is the only finger that can come in contact face to face with all of the other fingers. So this is like opposition, and it can reposition itself back to its anatomical position. So I will stop here. In the coming video, we will start to see selected synovial joints. We'll go through some details regarding them.